In this video, I will be demonstrating how to perform a 7-site Skinfold assessment on a client using proper technique. Before beginning the assessment, it is important to remember that all measurements will be taken on the right side of the body. We will mark the 7 sites using either a pen or marker. So now let's find these sites, shall we? The first site we'll find today will be the tricep. It is important that the client stand with their arm held freely on the side of their body, and the site is located on the posterior midline of the upper arm, halfway between the acromion and the olecranon processes. Next, we will find the subscapular site, which is easier to find by having the client put their arm behind their back so the scapula pops out. The site will be marked 1 to 2 centimeters below the inferior angle of the scapula. The next site will be the chest pectoral site, which will be 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance for women. The next site is the abdominal site, located 2 centimeters to the right side of the umbilicus. We then move over to the suprailiac site, which will be easier to find by having the client point to their hip bone. It will be marked in the anterior axillary line immediately superior to the iliac crest. Next, we find the mid-axillary, which is located on the mid-axillary line at the level of the xiphoid process of the sternum. The last site will be on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease of the hip. Those will be the 7 sites that we will be using for today's. Now that all the sites have been marked, we will begin the assessment. But before beginning the assessment, here's a few things to remember. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skin fold, and halfway between the crest and the base of the fold. The pin should be maintained while reading the caliper, and you should wait 1 to 2 seconds before reading the caliper. It is important to make sure that we don't pinch any muscle and aren't just pinching skin when taking the skin folds, as this will apply to every pinch at every site. The tricep will be our first fold, which will be a vertical fold, and we will hold for 1 to 2 seconds and record our measurement. The subscapular fold will be our next one, which will be a diagonal fold at 45 degrees. We'll also hold 1 to 2 seconds and record our measurement. Next, we move to the chest and pectoral fold, which will also be a diagonal fold. We will pinch, hold for 1 to 2 seconds, and record our measurement. We will then move over to the mid-axillary. The mid-axillary fold will be a vertical fold. We will pinch, hold for 1 to 2 seconds, and record our data. Next, we move to the abdominal fold, which will be a vertical fold. We will pinch and hold for 1 to 2 seconds and record our measurement. The suprailiac fold will be a diagonal fold in line with the natural angle of the iliac crest. We will pinch, hold for 1 to 2 seconds, and record our measurement. Lastly, the thigh will be a vertical fold. It is important to make sure the weight is placed on the left leg so it is not on the right leg. We will pinch and hold for 1 to 2 seconds and record our measurement. Duplicate measurements should be taken at each site, and a retest should be done if the duplicate measurements are not within 1 to 2 millimeters of each other. When taking the duplicate measurements, one should rotate through the measurement sites or allow time for skin to regain normal texture and thickness.